This video is about the performance rating standards and their application in a practicum setting. The student's performance is evaluated based on their level of competence at the end of placement using the performance standards that will be described in this next part of the video. Growth and learning throughout the experience are expected. It is also expected that there will be an ongoing exchange of ideas, feedback, and collaboration between the student and the preceptor. The preceptor maintains ultimate responsibility for dietetic practice undertaken by the student, be it in the nutrition care of the patient or in group or project settings. The preceptor is also responsible for ensuring that the student is not assigned functions and tasks that they are not competent to perform. The preceptor has a responsibility to observe and supervise the student to appropriately evaluate their performance on the various skills and activities. The performance rating categories are as follows. NA, not applicable. E, or exposure and discussion. S for supervision, M for minimal supervision, and C for competent. Let's go through each of the categories in more detail. Not applicable means that this activity was not part of the placement experience. Exposure or discussion. This describes experiences at the exposure level only. The students may have observed and or discussed the activity, but have not performed them in a hands-on way. Supervision. Supervision means that as a preceptor, the student requires significant guidance in situations where rules do not apply. The student requires explicit instructions to complete tasks. Significant direction from the preceptor is required to ensure safe practice. The preceptor's direct presence is required. Minimal supervision is when a student is able to identify most relevant details, but may require some assistance to identify, interpret, and prioritize their data or their tasks. Some direction from the preceptor on key items is still required to ensure safe practice. As a preceptor, you may or may not need to be directly present. Competent performance means a student is able to consistently identify and interpret key aspects of an issue, a situation, or to perform a skill. Intervention on the part of the preceptor is required for coaching only. Your direct presence as a preceptor is not required to ensure safe practice. Non-competent behaviors is when a student is making errors without recognizing them or learning from them, when they demonstrate inappropriate communication skills, or when they lack the ability to recognize their self-limitations or their knowledge deficits. If you have concerns that your student is demonstrating non-competent behaviors, please inform the student's dietetic education coordinator so that quick action can be taken to address this. A note on supervision. It is important to distinguish between supervision for the purpose of evaluation and supervision as defined in the rating scale. If a preceptor observes a student performing an activity and does not need to intervene, guide, or direct the student, then the student can be deemed to have completed the objective competently, or a C rating. The preceptor's direct or indirect supervision was necessary only for the purpose of evaluating the performance of the student. If a preceptor observes a student performing an activity in which the preceptor must intervene to provide guidance or redirection, then the student's rating would be either supervision or minimal supervision, depending on the amount of intervention required. What does demonstrating competence look like? This video will conclude with 3 examples and descriptions of various performance ratings across some common placement experiences. In a clinical setting, we will discuss integrating assessment findings to identify nutrition problems. What are we asking the student to do here? We're asking them to review all the data they've collected in their nutrition assessment, to integrate the individual pieces of the nutrition assessment data to develop a holistic assessment of the individual's nutritional status, and for them to identify and justify a nutrition diagnosis. Students at a supervision level may not consider all the nutrition assessment data and require significant direction from their preceptor to integrate the assessment data in order to develop a holistic nutrition assessment. With substantial guidance and prompting from the dietitian, the student may identify a nutrition problem. Students at the minimal supervision level are able to identify some of the priority nutrition problems some of the time, and with some guidance or prompting from their dietitian preceptor. At entry to practice, or at the competent level, a student is able to consistently identify the priority nutrition problems and justify their nutrition diagnoses based on the student's assessment when discussing the patient case with their dietitian preceptor. Priority problems are the most important, the acute, the high-risk issues only. Competent practice does not mean that the student will consistently identify and address the more nuanced or subtle nutrition issues that a dietitian with years of practice in an area would identify and address. This is expert practice and is beyond that which is required at entry to practice. Next, we'll consider a placement in an outpatient setting. A competent student is one who is able to conduct a nutrition counseling session safely and effectively with indirect supervision from their preceptor. Indirect supervision might look like this. The preceptor is available at the start of the session when the student and the patient first meet, but then the preceptor excuses themselves from the session. The student may step out of the conversation with the patient to check in with the preceptor before implementing the nutrition care plan. The student is able to describe the issue and justify the care plan with minimal or little input from the preceptor. The preceptor may check in with the patient at the end of the session to ensure all their concerns have been addressed. Any identified concerns by the patient are minor, and there are minimal additional patient questions that come up. The student documents the patient encounter. The preceptor has minor or no concerns with the content or format of the documentation. This example also demonstrates the many competencies and related performance indicators that connect and apply to one practice activity, such as conducting a counseling session. And finally, we'll consider 4.02, assess and enhance approaches to practice. What are we asking students to do here? We're asking them to assess a practice situation, to interpret and consolidate evidence to establish a course of action, to plan the implementation of this action, and to evaluate it. This activity can occur in any placement, from research, practice-based projects, nutrition care, population health promotion, and food provision. At a competent level, the student is successfully able to identify, collect, and thoughtfully integrate relevant information to assess a situation for a dietetics-related project, program, or service. They're able to determine priority goals and set a realistic plan for intervention. The student identifies key evaluation requirements. In this situation, there's a collegial exchange of ideas between the student and preceptor. The preceptor provides coaching, and the student contributes meaningfully with actions and recommendations that are reasonable and safe given the context of the situation. As with other competencies, this competency is not performed in isolation. And in the case of a competent student, they will engage collaboratively with the preceptor and other relevant stakeholders in this process. This is 3.07, participate in collaborative practice. So what could this look like? In food provision, the student may use quantitative and qualitative data from patient satisfaction surveys to obtain the patient perspective. Using this information alongside data provided from the waste audits, the finance department, food service job descriptions, and nutritional analyses, the student integrates and interprets this information to provide reasonable suggestions for improvements to the hospital menu. In population health promotion, the student may use community-level data on local determinants of health and interactions with key community voices to build, implement, and evaluate a responsive curriculum around a nutrition-related topic.